What qualities describe a great nurse? Derek, a 26-year-old neurology nurse, is coming in for his 7:15 a.m. shift. He is given report by his night shift colleagues and finds out that he is looking after 3 patients. He glances over each Cardex and prepares to begin his morning rounds. He begins his rounds by checking up on Mrs. Y. As he introduces himself, he noticed that Mrs. Y is confused about her surroundings and is unable to recognize where she is. Mrs. Y is a 45-year-old female with a diagnosis of brain tumor. Derek notifies the staff attending and later finds out that Mrs. Y was experiencing a stroke, but luckily it got caught early with minimal health impairments. Here, Derek demonstrated the important nursing quality of observance. Derek then proceeded with his rounds and decided to check up on Mr. X. Mr. X is a 65-year-old male with a diagnosis of multiple sclerosis who is of Jewish descent. As Mr. X is a new admission to the unit, Derek must input a diet order in the hospital system. Reflecting back on his cultural knowledge, he is aware that those of Jewish faith must have kosher meals. However, to prevent any wrong assumptions, Derek inquires Mr. X about any diet restrictions and finds out that he does choose to eat non-kosher foods. Here, Derek demonstrated the quality of cultural competence by being sensitive to the individual preferences of the patient, being a lifelong learner. Proceeding to complete his rounds, Derek stumbles upon a Ryerson nursing student that appears to be crying at the back of the unit. Upon inquiring, he learns that the student is crying because she is overwhelmed with her school assignments, clinical practice, and her upcoming NCLEX exam. Derek sits beside the student and provides comfort as he knows what she is going through and feels her pain. Here, Derek is demonstrating the nursing quality of empathy. As the student begins to feel better, Derek proceeds to his last patient, Mrs. Z, who is accompanied by her over-involved daughter who likes to make decisions for her mother without considering her mother's choices. Mrs. Z is a 9-year-old woman with history of brain aneurysms. Derek politely asks Mrs. Z's daughter to step out the room as he discusses and analyzes with Mrs. Z the progress of her own plan of care with only her own input. Here, Derek demonstrates the quality of advocacy as he speaks up for Mrs. Z to make her own medical choices. Overall, Derek exhibits the core qualities of the nursing profession through the daily encounters that he faces on his unit. Again, these being observance, cultural competence, empathy, and advocacy.